really need that protein for your uterus because it has a big job to do at the end of your pregnancy. And it needs the protein to be strong for that. It also contributes to the formation of antibodies, which help prevent sickness. It's necessary for fighting infection, as well as the formation of breast milk. That is pretty important, especially if you're planning on breastfeeding, which I hope you are, for a whole nother variety of reasons, which I can make another video or two on that, just breastfeeding. Proteins are essential for healthy blood clotting, which are necessary after you give birth. You don't want to continue bleeding. You want to be able to clot well. And same with the baby. The baby needs to be able to clot any bleeding that occurs due to birth or birth trauma, which can happen. The baby's hormones, growth, metabolism, and sexual development are made possible with proteins. So again, they're really, really important. Childbearing, due to the increased size of and amount of the mother's tissues, the baby's needs in labor, postpartum healing, and lactation requires an increase in protein consumption. An inadequate amount of protein is associated with toxemia, and which is really not bad. I mean, really not good. Big frowny face, toxemia. So yeah, eggs are awesome if you're thinking of like, what can I have that's protein that you already like. If you don't eat eggs, try them. Maybe you're allergic to them, so don't try them. Another component that's really important is water. You need water for another variety of reasons. You know, like what life can really survive without water. Cactuses in the desert still need water. They just store it really well. So water needs to be consumed about half of your body weight in ounces. So I weigh 140 pounds, half of that is 70, so I need to be drinking about 70 ounces of water just to maintain a healthy water balance. So water balances your pH, your alkaline acid balance. It also creates and is huge for the fluid that is surrounding your baby. That needs to be pH balanced, but also there needs to be a sufficient amount of fluid in there so that the baby can grow healthy. Pregnant woman needs to drink even more to facilitate the growth of the baby, and as the weeks increase of pregnancy, so does the amount of water needed. Just to keep that in mind. Vitamins and minerals, also very important part of your caloric intake. Eating foods that are high in vitamins, high in minerals. There are different kinds and amounts that are needed for different tasks. A mother who pays close attention to having a whole food, varied diet that's high in vegetables, fruits, grains, nuts, and those sorts of things, greens, she probably won't need to be taking a supplement. But it's possible that there's a deficiency already, and that can be determined by your care provider, hopefully. Important things in vitamins and minerals would be iron. You don't need to overdo iron, but it is the most common cause of anemia, pregnancy anemia. Another common cause of pregnancy anemia is B12 and folic acid. Those are really great to include into your diet through, well, folic acid, think of foliage. So eating lots of greens, dark leafy greens. B12 can be found in, I think, nutritional yeast, bee pollen, spirulina, chlorella. Eggs are awesome. So if you're not able or open to eating those things, then considering a B12 or folic acid supplement is a good idea, particularly for the first month of pregnancy. If you know you're pregnant early, folic acid is crucial for the development and the finalization of the spinal cord development. So if you're not getting sufficient folic acid, there can be defects that occur during the formation of the spinal column. There are many women who do need to add supplement nutrition or nutrients through vitamin or prenatal vitamin. Fortunately, there are some really great vitamins, prenatal vitamins on the market, but there's also some that are not helpful at all. So doing a little research into that is a good idea. And in my next video, we'll talk a little bit about what vitamins are needed in what amount. So for now, I hope that that was helpful. Basically, to sum it all up, that just eat a great diet, ideally organic, with plenty of green leafy vegetables. These are on almost every vitamin and mineral list. So green leafy vegetables, like, you know, therapeutic dosage of greens would be a pound a day. So that's kind of a lot. If you want, you can eat that much. If not, then you need to be probably eating other vegetables to make sure that you get what you need, or supplementing. So colorful veggies, sea veggies like seaweeds and things, nuts and seeds, oils, fruits, berries, grains, legumes, and fluids. Supplement when necessary with a really high quality prenatal or with superfoods. And if you want to learn more about superfoods, just Google it. Things like spirulina, bee pollen, chlorella, blue-green algae, maca, cacao, goji berries are awesome, and things of that sort. So, I hope that isn't overwhelming, and I will be seeing you again soon in my next video. Aloha.